Okay, so to join the conversation, we have the committee's chairman, that's the House Committee on, trying to get that right here. But Dr. Amos Magaji will be joining us. He's the chairman, House Committee on Health. Welcome to the show, sir.
Thank you for having me.
So what are your thoughts on this issue of japa, especially in the health sector? We're having wards closed down. We're having doctors and nurses leaving the country. What do you think the National Assembly can do to curb these migrations?
Well, first of all, I want to thank you for this all-important discussion this morning. And I want to state here categorically that the problems we're having in the health sector didn't start today. And then because the health sector has been left abandoned for long, the problems we're seeing now as a result of the negligence for many years. For example, let's look at the budget for health. Most times, when we look at the budget of Nigeria, we think the budget is so huge. But when you divide it by different agencies, you discover that the budget cannot even go anywhere. We have health institutions where COVID-19 came and revealed the state of our health institutions. Yeah, I understand the response was good, but it wasn't enough. And therefore, I remember somebody was, I listened to somebody saying if you are paid 120,000 here, and then you have somewhere you can be paid $80,000, why would you leave that? And I think that's one of the major problems. I just came back from tour of many of the health facilities in the Southwest, and it's so alarming the number of doctors leaving. And basically, one of the first reasons that is making them leave is numeration. We also have in this period where there are people that have been employed, yet they have stayed for 7 months without being paid, and they are still working. So if you have a place where the day you land, you are receiving your salary, why will you stay? If you have also a place whereby, for example, none of us seated here, that you have worked for 20 years and you don't have a roof over your head. You struggle to have a car to drive. You struggle to send your children to school. And then an offer is made to you that you're not looking at it. Maybe in 10 years, I may be retiring, and yet I don't have anywhere to stay. It's a big enticement.
So we understand the problems, sir, definitely. We can even write a book on the problems. What do you suggest are some of the solutions we can begin to employ?
Yeah, that's what I read on that first. We don't understand what is causing the problem. We may not be able to solve it. So first of all, you see, one of the things that I recommend that we can do at this period is, number one, making sure that, for example, immediate is to have one-on-one replacement of medical doctors. Even with the yearly employment, you hardly even get enough to put. But if somebody leaves today, the hospital should be able, if they find somebody, to replace him immediately. But somehow there are bottlenecks. We're discussing with the ministry and then, of course, engaging some relevant government agency to ensure that that waiver is given to health sector. Number two is to also ensure that those that have not been paid, to see that they have been paid. You can't stop those that have gone. You can't bring them back immediately. If we make the system attractive, many of them may still come back. But what we need to do right now is to make sure that we declare a state of emergency on health. And I think when that is done, then we can quickly look at many of the things, bills that will ensure that from the day you join the hospital, there may be a requirement that you have to fulfill before, even if you will leave the job. Incentives that will keep doctors and other health workers in the hospital. And then, of course, equipping the hospitals. Many of them are working without equipment in hospitals. I went to many tertiary institutions, like teaching hospitals, without MRI machine. Some of them, they have obsolete CT scan machine, and many of the labs without the relevant equipment to work with. So if we declare a state of emergency and make sure that a lot of intervention are made in the health sector, and then also the issue of those that are there, to make sure that there are things to keep them and listen to the doctors, in which this week I have a meeting with all the union leaders of all the hospitals, so that we can sit down and let me hear from them again. What do you think we need to do? So that together with them we'll proffer solution to making sure that those that are there will not leave. Another thing is to ensure that we broaden the quota system. Since I became chairman, I've also received several requests that people that want to go for house job, and then the hospitals are not receiving them because they say, okay, we have placed this quota and quota, you can only take this number. Time intervention, we look at how to encourage our young ones to join the medical schools, because
Oh, hello, sir. We have some issues there. Nima, you're going to say something?
Because me, I'm hearing big English. I know English is not, I'm not a friend of English. Simplify it so that I can comprehend it. So I'm hearing quota, I'm hearing this and that. I'm wondering, how much do we know about the number of people studying
Okay, I'm told he's back. Hello? Hello, sir, you have a question. Are you there?
Hello?
Nima has a question for you. Please, listen in.
So,
thank you.
as a House of Reps, how familiar are you with the number of graduates or undergraduates who are studying medicine right now in our colleges, and whether, you know, there's vacancy for them in our medical institutions, hospitals, our public hospitals across the country? Also, how often do we do a replacement arrangement? Tokwe talked about how the Lagos State has put it on an automatic replacement within the state for every vacancy that they have. How often, how well versed are you about it, and how do we plan to replace the doctors that are leaving? Because I am aware of some young doctors trying to get into the public hospitals, but they can't because they don't have somebody to sponsor that. So how is the employment process like?
Yeah, that's what I'm saying. Right now, we are also, one of the meetings we are also going to hold, as I told you, we are also going to involve with the university system. Hello, can you hear me?
Yes, sir.
Yes, sir.
Can you hear me?
Yes.
Can you hear me?
He can't hear us.
We are also involving the university. That's why I told you that one of the long-term, involving the university system is not one of the immediate plan, but we are also having a meeting with them, all the medical faculties in Nigeria. Then
Okay, we're having network issues, so we can't really hear you again, sir.
that's
I'm sure.
one of the inter we're going to do. While we are saying that we need to involve some of the government agencies, we discovered that I spoke with some of the CMD. They get the waiver to employ every year, but before you go through a lot of processes. Sometimes from the time you submit a request for waiver, it takes more than 3 months before they allow you to employ. And by the time you employ, sometimes the issue of capturing, not capturing, IPPIS, not paying, and so on. So these are the relevant stakeholders that we are going to meet and declare that when it comes to health workers, you should give a waiver and expedite every process of recruitment. Right. That is what I said. This week we're engaging some of them in discussion, because I had to personally take an oversight to some of these health institutions, sat down with their management. What are the problems that you are having? And employment, the number of doctors leaving, and then to replace them became one of the major problems. And then lack of equipment, harassment. Some are also working in places that are so difficult. So these are some of the things that we are discussing. We have a meeting this week with the CMDs. We also have a meeting this week with the union leaders. All right. So we're going to...
Go ahead.
Dr. Amos, I'm happy that you have, obviously, a clear understanding of the problem. We know the problem as well. I'm happy you know it. It seems like you are complaining the way we are complaining. So my expectation would be that you would be telling us the steps you are going to carry out within your committee and their oversight abilities, because you're still calling them to interview them. But what do you want to enforce? What are the are you going to push for a new bill that is going to make it compulsory for re-employment? Are you pushing for a new bill? As in, what are the things that you will be doing to cause the change we need? Nigerians are eager for change. There is a crisis within our health sector.
Yeah, you see, the truth about it is that to go into things smoothly, you don't just declare that, okay, go and do that. You get the agency and say, why I this and that? Because they've reported that most time it takes them long before the yearly employment to get waiver, and then they do it with others. So sitting with IPPIS, sitting with the budget office and some of the relevant agency, the sitting is not going to take 2 days. It's just one day, then we're here, and then together with everybody, we agree on what to do. We are not going to sit together. I don't like all these, someone will just sit down and make pronouncement. It's one thing to make pronouncement. It's another thing to implement it. So let's sit down with those that are implementing it and know if there's any other problem they are having, the same way I started with the CMDs. If there are other problems they are having that is making them not to implement this thing immediately, let us know. So that together we agree on step 2. Let everybody know that the healthcare system in Nigeria right now is an emergency. Nobody decides to be sick. You can decide when to build a house. You can decide when to go to school. But nobody sit down and say, okay, I'll be sick next year. No, it's also an emergency. So issue of health must also be tackled that way.
Are you going to start visiting these hospitals yourselves to make sure that
the changes are implemented?
Are you going to be on ground? Like you will go to Luth, you will surprise them in Maiduguri?
In fact, one of the things we do is that I've had oversight that I went without even informing the hospitals we are coming. And then even those that knew that we were coming, sometimes they take you to a path that they want you to follow. During the oversight, we just branch into places they don't want us to go. And interview patients, patient relations.
All right.
You know, these are not people that they arrange to interview.
Sir.
Okay.
Get some workers.
Right.
One of the cost of...
There is no hospital I went without visiting or calling the unions to have a one-on-one discussion with them.
Yeah.
If the management is hiding something from you, the union will not hide something from you.
Okay, sir.
And if the union are also hiding, the patient that is suffering in that hospital will not hide it.
Right. Okay, let me get the final question for you.
So one of the costs of this japa again is that Nigerians have started to resort to self-help, cook their agbo, do what their ancestors did and what not. You know, and we hear medical practitioners constantly advise Nigerians to discourage Nigerians from doing this. Are you looking to develop these other areas of medicine so that at least if they all leave, we'll be able to plug leaves from our backyards and help ourselves?
Okay, one of the reasons why I said we need we declare a state of emergency in health sector is that in these 4 years of this assembly, one of the key area what I want is to make sure that even the medical tourism itself is reversed, or the trend is reversed. Now, sitting down with many of the medical doctors, CMDs, we're looking at trying to make sure that we specialize our healthcare. For example, if Lagos is very good in treatment of cancer, I mean Luth, then every assistance that needs to be given, let's make Luth a destination of choice when it comes to treatment of cancer. Then we look at other areas, because if you cannot give all the machine to all the teaching hospitals. So to strengthen one in a particular field and to strengthen that while they go about doing all other practice, with that we'll restore confidence in Nigerians, so that those that even have money to travel abroad, because let me tell you, no matter how rich you are, there are medical emergency that you have. If you can't get intervention near you, you will die before you cross Mediterranean Sea. So it's of our own good to have system working. And I don't want us to move so far from COVID before we start implementing this. When we move so far from COVID, we will forget how we were locked down in one place and nobody with your billions, you could not travel out of the country.
All right,
so
Dr.
it is
Magaji.
our own advantage that we
not doing
develop
research.
our healthcare.
I have to let you go at this point. Well, thank you. I mean, you're very right. Yeah, we've been discussing this conversation and this of why they're leaving, and we're going to continue to talk about it until we get some kind of a solution. But thank you very much for what you're doing so far, and we wish you the best, that you'll be able to indeed resolve this issue, especially at the National Assembly's level. Thank you, sir.
Thank you very much. Thank you.
I have to wrap up, but I really wanted to wrap up with a note from our engineer, Dr. Tijani. He always sends me something really important and apt. But before I read his own comment, there's something that an old man I spoke to about 2 weeks ago. He's in his almost 80. And I was asking about Nigeria. He said, Mariam, there are 3 things that are missing from how we're raising our children: empathy, love, and respect. That these children today lack empathy. They don't love each other. They don't love our people. They don't love Nigerians. And they don't respect their elders. Because they lack these things. That's why they grow up. They don't care about Nigeria. They don't care about the country. They don't care about community. They are raised to think it's all about me, myself, and I. They want to leave the country. They want to go there. They're all about my own ambition. When they were growing up, it was how can I give back to my community? How can my family, my loved ones that I respect and love and empathize with, how do I support them? What can I do to contribute to what I have seen? So it's also, as much as we can solve the issue of speak to hospitals, pay more better salaries, if these ones we are raising don't have empathy, love, and respect, or they're selfish, we're not raising them to love and give back, or even believe in Nigeria, we're going to lose them at some point.
One more word you have missed there is patriotism.
Patriotism, yes.
If we don't learn to love our country, that this is where I am a first-class citizen.
We don't raise our children to be patriotic anymore. Nobody can be, we hardly do.
We need to be conscious.
We very must be intentional, be intentional about being patriotic about our country. We have to wrap up, unfortunately.
To also research our alternatives. Let's grow. Maybe this is an opportunity universe, according to this, have given to us to grow our own.
All right.
You know?
That's all we can take on today's show. Hope we learned a few things as we have. See you tomorrow. Bye for now.